name is Megha Garg, and I am an affiliate faculty member at the Philip R. Lee Institute for Health Policy Studies. I am an associate professor of medicine at UCSF, and clinically, I am an inpatient hospitalist at the San Francisco VA hospital. I have a number of roles as a clinician educator, and I have worked as a course director in the medical school and now have an associate program director role for the internal medicine residency. And so what I'm thinking about is really across the spectrum of medical education, from students to faculty to residents. How do we incorporate health equity and anti-racism and social justice into medical education? This was certainly not something that I learned about directly in medical school. And so we've really had a shift in how we think about a physician's role in issues of social justice in health policy beyond the individual patient-physician relationship. And so, my work is focused on building curriculum and curricula to incorporate these applications of social justice into medical education. And more specifically, not only how do we think of ourselves in the health system as physicians and how we can impact policy and our health systems, and then how do anti-racist practices and social justice get incorporated into our daily practice as physicians with our patients and within our immediate environments. And so I think there's some examples of from the medical school. For example, we are building curricula specifically thinking about health equity. What are the structural factors that bring my patient to me with their current disease state? It is not just individual behaviors, but it's also the environment in which they live, the historically racist policies that didn't allow people in certain neighborhoods, for example, to get adequate housing or live in less polluted environments or have adequate access to food or to education, which impacts the opportunities that they had to be healthy and to take care of themselves. And so it's not just a disease process that is bringing them into the hospital, but all of these factors that have led to and contributed to their lives today. So how do we take that idea and bring that to the medical students? And then similarly, when we get into our clinical world, and we're, the medical students come to the hospital in their clinical years, the residents are in their training post-medical school. How do we bring those ideas into our day-to-day on the clinical services when we're talking about our patients? So, and caring for our patients. And so, those are the things that I work on, and those are the things that I collaborate on with members of the faculty, with our students and residents who bring so many rich lived experiences to contribute to the work that we're doing in medical education, and then of course our patients and our community, who are really our best teachers on how we can be thinking about health equity and structural determinants of health.